2019 to 2020 Wuhan coronavirus outbreak. A new coronavirus, designated 2019 nCoV, was identified in Wuhan, Hubei Province, China, after people developed pneumonia without a clear cause and for which existing vaccines or treatments were not effective. The virus has shown evidence of human-to-human transmission, and its transmission rate appeared to escalate in mid-January 2020, with several countries other than China reporting cases. The incubation period of the virus is between 2 to 14 days, and it remains contagious during this time. Symptoms include fever, coughing and breathing difficulties, and it can be fatal. Wuhan was placed under quarantine on January 23, in which all public transport in and out has been suspended. Thereafter, transportation in at least 15 other cities in Hubei Province have also been halted in a similar fashion. Many New Year events were closed over fear of transmission, including the Forbidden City in Beijing, traditional temple fairs, and other celebratory gatherings. Hong Kong also raised their infectious disease response level to the highest level and declared an emergency, closed its schools until mid-February, and cancelled its New Year celebrations. A number of countries have put out travel advisories warning against travel to Wuhan and Hubei Province. Travelers who have visited mainland China have been requested to monitor their health for at least 2 weeks and contact their healthcare provider to report any symptoms of the virus. Anyone who suspects themselves to carry the virus are advised to wear a protective mask and seek medical advice by calling a doctor rather than directly visiting the clinic in person. The travel sector has been providing refunds and no-fee cancellation for reservations in mainland China or by people from mainland China. Airports and train stations have implemented temperature checks, health declarations, and information signage in an attempt to identify carriers of the virus. Chinese scientists were able to isolate a strain of the new coronavirus quickly, with the genetic sequence being made available for laboratories across the world to independently develop PCR tests that can confirm infection in a person. Of the first 41 people confirmed by real-time RT-PCR and next-generation sequencing to have been infected, 2/3 were found to have a link with the Huanan seafood wholesale market, which also sold live animals. The seventh member of the coronavirus family to infect humans, 2019 Gov's genome sequence has been reported to be 75 to 80% identical to SARS-CoV, and more than 85% similar to several bat coronaviruses. Whether this virus is of the same severity or lethality as SARS is unclear. Extensive testing in mid to late January has revealed over 2,800 confirmed cases in China, some of whom were working in healthcare. Confirmed cases have also been reported in Thailand, South Korea, Japan, Taiwan, Macau, Hong Kong, the United States, Singapore, Vietnam, France, Nepal, Australia, and Malaysia. The first confirmed death from the coronavirus infection occurred on January 9. By January 26, the number of deaths due to 2019 nCoV stood at more than 80, all in China. Wuhan is the capital of Hubei Province and is the seventh largest city in China, with a population of more than 11 million people. It is a major transportation hub of the country, long known as the Nine Provinces Thoroughfare. It is approximately 1,100 kilometers south of Beijing, 800 kilometers west of Shanghai, and 970 kilometers north of Hong Kong, and the Wuhan Railway Hub is one of the four most important railway hubs in China. Direct flights from Wuhan also connect it with Paris, London, and Rome. In Wuhan, during December 2019, an inaugural cluster of cases displaying the symptoms of a pneumonia of unknown cause was linked to Huanan seafood wholesale market, which had 1,000 stalls selling fish, chickens, pheasants, bats, marmots, venomous snakes, spotted deer, and the organs of rabbits and other wild animals. The immediate hypothesis was that this was a novel coronavirus from an animal source. Coronaviruses mainly circulate among animals but have been known to evolve and infect humans, as in the cases of severe acute respiratory syndrome, SARS, and Middle East respiratory syndrome, MERS, together with 4 further coronaviruses that cause mild respiratory symptoms similar to the common cold. All coronaviruses known to infect humans have been shown to spread from human to human. In 2002, an outbreak of SARS that started in China resulted in more than 700 deaths worldwide. The virus originated in horseshoe bats, then passed to humans via civets from live animal markets, and with the help of a few superspreaders and international air travel, reached as far as Canada and the United States. The last case of SARS occurred in 2004. At the time, China was criticized by the World Health Organization, WHO, for its handling of the epidemic. Since 2000, the WHO has coordinated international reactions against this and other new diseases, including MERS and the 2009 swine flu. 10 years after the onset of SARS, the dromedary camel-related coronavirus, MERS, has resulted in more than 850 deaths in 27 countries. The Wuhan outbreak's association with a large seafood and animal market has led to the presumption of the illness having an animal source. This has resulted in the fear that it would be similar to the previous SARS outbreak, a concern exacerbated by the expectation of a high number of travelers for Chinese New Year, which began on January 25, 2020. Phylogenetic studies of 2019 nCoV examine the evolutionary history of the virus and its relationships with other organisms. The 7th member of the family of coronaviruses that can infect humans, 2019 nCoV, has been reported to have a genome sequence 75% to 80% identical to the SARS-CoV and to have more similarities to several bat coronaviruses. At least 5 genomes of the novel coronavirus have been isolated and reported. These show that the virus is genetically distinct from other known coronaviruses such as severe acute respiratory syndrome-related coronavirus, SARS-CoV, and Middle East respiratory syndrome-related coronavirus, MERS-CoV. Like SARS-CoV, it is a member of Beta-CoV lineage B. Before the 2019 to 2020 outbreak, a study from 2015 published in Nature warned about potential risk of SARS-CoV re-emergence from viruses circulating in Chinese bat populations. Using the SARS-CoV reverse genetics system, Ralph Barrick team generated and characterized a chimeric virus expressing the spike of bat coronavirus SHC014 in a mouse-adapted SARS-CoV backbone. Both monoclonal antibody and vaccine approaches failed to neutralize and protect from infection with this CoV-S using the novel spike protein. The transmissibility of the virus between human to human has been variable, with some affected people not transmitting the virus to others while others have been able to spread the infection to several people. The basic reproduction number for the human-to-human transmission of the virus has been estimated as between 1.4 and 3.8 by several research groups. The number describes to how many people a newly infected person is likely to pass the virus in the human population. The new coronavirus has been reportedly able to transmit down a chain of up to 4 people so far. The natural wildlife reservoir of the 2019 nCoV and intermediate host that transmitted the 2019 nCoV to humans has not been confirmed, and results of animal sampling from the market are not yet available. However, it is likely that the primary reservoir for the virus is bats. An updated preprint paper published January 23, 2020 on bioRxiv from members of the Wuhan Institute of Virology, Wuhan Jinyintan Hospital, University of Chinese Academy of Sciences and the Hubei Provincial Center for Disease Control and Prevention suggests that the 2019 novel coronavirus has possible bat origins, as their analysis shows that nCoV 2019 is 96% identical at the whole genome level to a bat coronavirus. On January 22, scientists from Peking University, Guangxi Traditional Chinese Medical University, Ningbo University, and Wuhan Biology Engineering College published an article, which after looking at humans, bats, chickens, hedgehogs, pangolins, and 2 species of snakes, concluded that the 2019 nCoV appears to be a recombinant virus between the bat coronavirus and an origin unknown coronavirus, and snake is the most probable wildlife animal reservoir for the 2019 nCoV, which then transmitted to humans. Others have also suggested that 2019 nCoV developed as a result of viruses from bats and snakes combining. Some have disputed the paper from Peking and argued that the reservoir must be bats and the intermediate host, bird, or mammal, not snakes. Epidemiology studies of 2019 nCoV examines the distribution, who, when, and where, patterns and risk factors. The first 59 suspected cases at the end of December 2019 and early January 2020 were admitted to Jinyintan Hospital, which was specially designated to isolate them. 41 of the 59 were confirmed with the 2019 nCoV infection. Of these 41 cases, there was one group of family members, 30 were men and the average age was 49 years. Almost a third had an underlying medical condition, including 8 with diabetes, 6 with high blood pressure and 6 with heart disease. 2/3 had a history of exposure to the Huanan seafood wholesale market. The most frequently reported symptoms were 40 with fever, 31 with cough, and 18 with muscle aches and tiredness. Less frequent symptoms included coughing sputum or blood, headache, and diarrhea. Around half of the cluster had shortness of breath and 13 were admitted to intensive care. CT scans of all 41 people revealed pneumonia. Complications included 12 with acute respiratory distress syndrome, 6 with anemia, 5 with acute cardiac injury and 4 with secondary infection. On January 17, an Imperial College group in the UK published a Fermi estimate that there had been 1,723 cases with onset of symptoms by January 12. This was based on the pattern of the initial spread to Thailand and Japan. They also concluded that self-sustaining human-to-human transmission should not be ruled out, which has since been confirmed as happening. As further cases came to light, they later recalculated that 4,000 cases of 2019 nCoV in Wuhan City had onset of symptoms by 18 January 2020. A Hong Kong University group has reached a similar conclusion as the earlier study, with additional detail on transport within China. On January 20, China reported a sharp rise in cases with nearly 140 new patients, including 2 people in Beijing and 1 in Shenzhen. On January 25, the number of laboratory-confirmed cases stood at 2,062, including 2,016 in mainland China, 7 in Thailand, 6 in Hong Kong, 5 in Macau, 5 in Australia, 4 in Malaysia, 4 in Singapore, 3 in France, 3 in Japan, 3 in South Korea, 3 in Taiwan, 3 in the United States, 2 in Vietnam, and 1 in Nepal. Superspreaders were suspected multiple times by different experts and media. A widely believed superspreader patient was reported to have infected 14 different members of medical staff. On January 25, Gao Fu, the head of China's CDC, denied such claims and dismissed a media report claiming this, according to an announcement made to the official Xinhua news agency. Earlier the same day, however, China Newsweek, citing an expert from Peking University, claimed that the aforementioned patient could be considered a superspreader already, and criticized the hospitals involved for not having properly protected the staff who came in contact with the patient. China Newsweek also criticized the government's censorship, saying all doctors and nurses, except those in the fever clinic, have basically nothing but a mask to protect themselves. Reported symptoms have included fever in 90% of cases, fatigue and a dry cough in 80%, and shortness of breath in 20%, with respiratory distress in 15%. Chest X-rays have revealed signs in both lungs. Vital signs were generally stable at the time of admission of those hospitalized. Blood tests have commonly shown low white blood cell counts. On January 15, 2020, the WHO published a protocol on diagnostic testing for 2019 nCoV, developed by a virology team from Charité Hospital in Germany. There are concerns on whether adequate medical personnel and equipment are available in regions affected by the outbreak for hospitals to correctly identify coronavirus cases instead of misdiagnosing suspected cases as severe pneumonia. Many of those experiencing symptoms may decide to self-quarantine at home instead of going to a hospital due to long wait times and cramped conditions. Based on cases reported and assuming a 10-day delay between infection and detection, researchers at Northeastern University and Imperial College London estimated that the number of actual infections may be 10 times higher than those confirmed at the time of reporting. Imperial College estimated 4,000 cases with 440 confirmed by January 21, 2020, Northeastern University estimated 21,300 infections by January 26. 2019 nCoV does not have an effective medicine treatment or vaccine, though efforts to develop some are underway. Its symptoms include, among others, fever, breathing difficulties and coughing, which have been described as flu-like. To prevent infection, the WHO recommends regular hand washing, covering mouth and nose when coughing and sneezing. Avoid close contact with anyone showing symptoms of respiratory illness. Though there are no specific treatments for general human coronaviruses, the US CDC provides generic advice that an infected person can relieve their symptoms by taking regular flu medications, drinking fluids, and resting. Some countries require people to report flu-like symptoms to their doctor, especially if they have visited mainland China. On January 23, 2020, a quarantine on travel in and out of Wuhan was imposed in an effort to stop the spread of the virus out of Wuhan. Flights and trains in and out of Wuhan, public buses, the metro system and long-distances coaches were suspended until further notice. Large-scale gatherings and group tours were also required to be suspended. By January 24, 2020, a total of 15 cities, including Wuhan, in Hubei, were placed under similar quarantine measures. Due to the unprecedented quarantine measures, residents rushed to stockpile on essential goods, food, and fuel. The prices of goods were also significantly increased. Medical staff faced difficulties in commuting to their hospitals, as they were now limited to walking and private cars. Taxis and private hire vehicles would shun them upon knowing the destination. 5 million people left Wuhan, with 9 million left in the city. On January 24, Wuhan authorities specified its planning, saying they plan to have the hospital built within 6 days of the announcement and it will be ready to use on February 3. The specialty hospital will have 1,000 beds and it will take up 25,000 square meters. The hospital is modeled after the Xiaotangshan Hospital, which was fabricated for the SARS outbreak of 2003, itself built in only 7 days. Several organizations around the world are working on a vaccine. U.S. National Institutes of Health is hoping for human trials of a vaccine by April 2020. The Chinese Center for Disease Control and Prevention has started developing vaccines against the novel coronavirus and is testing existing drug effectiveness for pneumonia. The Coalition for Epidemic Preparedness Innovation (CEPI) is funding 3 vaccine projects and hopes to have a vaccine in trials by June 2020 and approved and ready in a year. The University of Queensland in Australia has received $10.6 million in funding from CEPI to develop a molecular clamp vaccine platform. Moderna is developing a mRNA vaccine with funding from CEPI. Inovio Pharmaceuticals received a grant from CEPI and designed a vaccine in 2 hours after receiving the gene sequence. The vaccine is being manufactured so that it can be first tested on animals. San Francisco-based Vir Biotechnology is evaluating whether previously identified monoclonal antibodies are effective against the virus. Gilead Sciences is in active discussions with researchers and clinicians in the United States and China regarding the ongoing Wuhan coronavirus outbreak and the potential use of remdesivir as an investigational treatment.